Well, good afternoon, everyone, and welcome to the Manitoba Legislature. I'm Kathy Cox, the Minister of Sport, Culture and Heritage, and the Minister responsible for the status of women. I am elated to be here today for this very exciting announcement that will improve access to healthcare services throughout our entire province. I'd like to acknowledge that we are gathered here today on the ancestral lands, on Treaty 1 territory, and the homeland of the Métis Nation. I'd also like to acknowledge my colleague, Audrey Gordon, the Minister of Health and Seniors Care, and the Minister of Mental Health, Wellness and Recovery. And welcome as well to the following guests here in attendance this afternoon. Kevin Hamilton, the past president of the College of Pharmacists of Manitoba, and Ashley Hart, past president of Pharmacists Manitoba, executive and members of the College of Pharmacists and Pharmacists Manitoba. The COVID-19 pandemic has been and continues to be a very significant time in our life. It has impacted the lives and livelihoods of all Manitobans. It has created and exposed challenges in our healthcare system, but it has also provided opportunities to find new and innovative ways to access care. As committed to in the speech from the throne, Progressing Together, our government is committed to addressing the ongoing challenges posed by COVID-19. We are focused on creating a stronger, more sustainable healthcare system with better care and improved access for all Manitobans. And with that, I'd like to turn it over to my friend, Minister Gordon, to expand on today's announcement.
Thank you, Minister Cox, and to our guests, thank you so much for joining me today. Good afternoon, everyone. Our government made a commitment to create a healthcare system that is more focused on the patient, one that is integrated and innovative. We committed to supporting communities and working together to offer better care sooner and more services closer to home. In 2019, we promised to make it easier for women to get help for urinary tract infections. Today, I'm pleased to announce that we are fulfilling that promise. Our government is expanding pharmacists' scope of practice to include assessments and prescriptions for some clients with bladder infections, also known as cystitis. These regulatory changes allow pharmacists to assess and prescribe treatment for recurrent, uncomplicated bladder infections or cystitis for non-pregnant women. These are relatively low-risk, recurrent infections that are often self-diagnosed, and oral antibiotics are the usual treatment. Clients will be able to access up to 3 pharmacist assessments per year at no cost. As you know, pharmacists play an important role in supporting the health of Manitobans, and these changes provide a faster, more convenient option for treating these infections. Faster, more convenient health care is a priority for this government, and this change will allow Manitobans to have access to health care sooner and closer to home. Thank you.
Thank you, Minister Gordon, for your advocacy and commitment to ensuring that Manitobans can access the health care they need when they need it. I am confident that this change will improve the health and well-being of many Manitobans, especially women who are most frequently require treatment for urinary tract infections. I'd now like to call upon Kevin Hamilton, past president of the College of Pharmacists of Manitoba, to the podium to say a few words.
Thank you, Minister Gordon, and thank you, Minister Cox, for the introduction. Our current president, Wendy Clark, is busy delivering patient care today, but sends her congratulations. The COVID-19 pandemic has underscored the important role that pharmacists play in patient care. Pharmacists have proven themselves to be among the most accessible of healthcare providers, and this amendment expanding the scope of practice of pharmacists supports improved patient care closer to home. Pharmacists are well positioned to help some individuals manage recurrent, uncomplicated bladder infections. In cases of recurrent, uncomplicated bladder infections in non-pregnant women, evidence shows that an effective diagnosis can be made on symptoms alone. Pharmacists will continue to practice within their knowledge, skills, and ability, and will refer to other healthcare providers as necessary. Pharmacists who choose to provide this type of care will have completed a training and authorization process before they begin prescribing for uncomplicated cystitis. This service should be made available in all or most Manitoba pharmacies in the next few months. Prescribing services will vary from pharmacy to pharmacy, so patients should contact their local pharmacy about prescribing for uncomplicated bladder infection, or they can search the Public Register of Pharmacists on cphm.ca for a list of providers. Thank you.
Thank you, Kevin. It's now my pleasure to welcome Ashley Hart, the past president of Pharmacists Manitoba, to the podium.
Thank you, excuse me. Thank you, Minister. I'm delighted to be here today representing Pharmacists Manitoba and on behalf of all pharmacists in our province who have been looking forward to this announcement. Pharmacists Manitoba has been advocating for the scope of practice for pharmacy to include the assessment and prescribing of recurrent uncomplicated cystitis, or more commonly known as a urinary tract infection, since 2019. And we are pleased to be present today to witness the implementation of this important women's health initiative. Prior to the COVID-19 pandemic, urinary tract infections, or UTIs, were one of the most common infections in primary care and in emergency rooms. UTIs affect 12 to 15% of women annually and produce symptoms that are unpleasant, cause discomfort, and affect quality of life. Pharmacists are ideally positioned in their communities to successfully manage uncomplicated recurrent urinary tract infections by providing timely and convenient access to care. We are pleased to join other provinces with this expansion of scope of practice, including fellow prairie provinces like Alberta and Saskatchewan. Across Canada, the scope of pharmacy is changing, and this announcement today brings us one step closer to enabling pharmacists to practice to their full potential right here in Manitoba. Although it is a busy time for pharmacists, we look forward to sharing this news with our members and the public. In addition to providing you with your prescriptions and comprehensive medication advice, pharmacists have been extremely busy administering flu shots, COVID-19 vaccinations, and rapid antigen tests. We ask Manitobans to give pharmacists and their respective pharmacies time to implement this change to ensure we are there for you when you need support. Pharmacists have been reliable pillars in their communities throughout the pandemic, and we are committed to continuing to provide trusted and accessible health care for Manitobans as we move forward. Thank you.
Well, thank you, Ashley, and thank you to all of the pharmacists across our province for the care that you provide to Manitobans. I know it's been very challenging, but we appreciate the important work you do. Thank you. As a minister responsible for the status of women, I'm proud to share our government is working diligently to advance gender equity across the province, with the objective to improve the economic, legal, social, and health status of women. We are committed to working in collaboration with our community partners and other government departments and agencies to identify the needs and concerns of women in Manitoba and address them through programs, policies, legislation, and grassroots organizations. Again, I would like to thank the College of Pharmacists Manitoba and Pharmacists Manitoba for their willingness and enthusiasm to work together to help improve timely, convenient health care for Manitobans. We will now open it up to questions. Thank you.
So for uncomplicated recurrent cystitis or urinary tract infections that we talked about, it's going to be basically based on symptoms, so symptom presentation. And there will also be red flags, is what we would call them, what we would watch for. So pregnancy is obviously one of them that make it a complicated UTI, in which case we would have to refer. Yeah, so if it can be based off of symptoms, if we can concretely make that diagnosis based off of symptoms, then we can move forward. Now, if it's a recurrent issue more than 3 times a year, then that would be a red flag and referral as well. Great. So most of the training, I mean, we do have some training in this already, but there is specific training required by the college. So that is released to pharmacists today, and they can start that process and apply to the college. I don't know if Kevin wants to comment on that as well.
Nothing specific other than just a required.
That's cool. Yeah.
As the College of Pharmacists of Manitoba, it is our duty to ensure patient safety. So what we do is develop some minimum requirements. As was already mentioned, pharmacists have undergone fairly extensive training on uncomplicated bladder infections and even more complicated. But the added piece to this, obviously, is the diagnosis. So we're looking to some of our other provinces who have done extensive work on development of training programs, and this will be the standard that we'll hold our pharmacists up to. So as long as they complete this required training process and meet all of the other stipulations that the college has set forth, then they can apply to get their license. So however long that process will take is somewhat determinant on the pharmacist or individual pharmacy. And actually, I might turn it over a little bit more to you. This is not quite the regulatory side, so I'm sure you'll have some data on that.
Yeah. So sorry, your question is, where do you currently present if you'd like to receive treatment or diagnosis of a urinary tract infection? Yeah. Right. So right now you would have to see a prescriber in either a nurse practitioner or a physician. That could be at a walk-in clinic, for example, or your family doctor's office. And then expanding this today, though, allows increased accessibility, right, into the pharmacy. So Manitobans, will be made aware of this, and then we anticipate that the uptake will be great based on that. Mm-hmm. Absolutely. Well, a couple things. First off is access to care. So really, we're hoping to work with the government to increase convenient access and timely access to healthcare, and pharmacists can be part of that solution. The other thing is that the expansion of scope of practice for pharmacists is quite well developed in other provinces, so we're really playing catch up here. And so, they've implemented these changes in other provinces previously with great success, so we're just looking to build off of that as well.
Great, thank you, folks. We'll now bring for pictures.
So we can just put all that there. Great.
Congratulations, by the way.
Thank you. About this? Or